Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And today we have two exciting guests. Again, one of the four subject matters that are the most, over these last 17, 18 years, talked about or we get information about is cancer, heart disease, minimally invasive surgery, and now there's a new, just jumped into the top four, collaborative medicine. That's just jumped in. So we're going to touch on some of that today. And in front of me is Dr. David Drew. Dr. Drew is a hematologist, oncologist, and he's with the Holy Cross Hospital's Vienna's Comprehensive Center, Cancer Center, correct?
Yes.
And we have Kelly Kugler, who is a registered dietitian. And I don't know what CSO means, Kelly, but you're going to have to tell me.
So CSO actually stands for Certified Specialist in Oncology Nutrition.
Oh.
So in addition to being a registered dietitian, I have that specialty in oncology, and I work with Dr. Drew at our Comprehensive Cancer Center at Holy Cross.
That's great, because as we spoke a bit before we started this program, I think everybody is starting to recognize how important our nutritive intake is, namely food and other, in quotes, products, that how they relate to body health. And that could be to everything from the full body spectrum. We spoke about it a few weeks ago in a similar sense in cardiac care and cardiology. But here we have a well-known oncologist, so we're going to stick on cancer and see what's going on here.
Okay.
So Dr. Drew, tell us what you do at the Holy Cross Hospital Cancer Center.
Thank you, Dr. Littman. My name is David Drew. I'm the medical oncologist and hematologist. Graduated from China some 23 years ago. And then after coming to this country, I have to redo the whole training again beyond the medical school. So I get my fellowship training with National Cancer Institute in Bethesda, Maryland. And after that, I joined Holy Cross Hospital. This is my year number 8. So over there, we are doing all kinds of adult oncologist and hematology treatment. We are carrying large amount of clinical trials, both for satisfying our academic penchant and also find a good cure or possible hope for our patients. So today, we have witnessing the burgeoning of all kinds of new cancer treatment, many new concepts, etc. And I'm pretty sure a lot of people have questions and some myths about all the things. So I'm happy to lend some of the explanations to those questions.
As we well know, we have the highest percentage of people in the United States, of people over age 70 that live in the state of Florida, many of which live right here in South Florida.
Yes.
But we have the highest number, not percentage, highest number of people over 85. So we have a wonderful quadrant of individuals that have made it through those periods of time and are wonderful, wonderful opportunities for the hematologists, oncologists, and the people who are involved with cancer therapy.
The reason for this high good age coming from the science, coming from a better nutrition, better medical field, etc., etc. And the oldest patient walking into my clinic is 102 years old, with cancer still coming in at this age, having treatment. But this is a double-edged sword for the new things, chemicals, etc., etc. All these things can improve your life, can also cause a lot of mutations, etc., to cause cancers.
So let's talk about what Kelly Kugler does at Holy Cross.
Well, it's definitely an exciting time to be a dietitian, especially at Holy Cross, because since I started about 2 years ago, we've really grown the nutrition department, and now we're constantly getting new requests for dietitians in different clinics and areas. And wellness is definitely key and a really up-and-coming field at our hospital too. So basically what I do in the cancer center is I help patients get through their treatments. Now, unfortunately, they're there because they have cancer. But a big part of what an oncology specialist dietitian does is also we're well versed in prevention. So at Holy Cross, we're trying to do more events to help patients or people who don't have cancer learn about ways that their diet can really reduce their risk of ever developing it. We actually have nutrition classes, healthy cooking demos that are free to the public. So I, along with our chef and some other staff members, will go over a cancer preventative diet, and then sometimes what is more important is how to prepare those foods, because I can tell you how to eat, but if you're not one to prepare that specific food or meal, it might be rather difficult for you. The best part of a cancer preventative diet is really our plant foods. And the nice thing about it is it's not just cancer prevention that a plant-based diet can help with, but also, like you mentioned, those other areas. So heart disease, really healthy nutrition can help pre and post any surgery you might need to have. And then also any chronic disease, really.
Right. You know, we have tried to place in the minds of our student population the fact that not everything is in a PDR, a physician desk reference, or not everything is now, and nobody reads anymore, so everybody's doing this, and you're seeing it up there. And you know, you have to know a little bit more about not only your patient, but you have to know more about what your patient is doing relative to nutritional intake. So we do a lot of teaching in that vein, so I just want to let you know. Dr. Drew, there's so much focus on gene therapy and the new techniques and I guess you could say, diagnostic tests as well to allow you to use whatever we have come about the last 10 years as far as chemotherapeutic agents for them to be used more effectively and more efficiently. You want to talk a bit about that?
Yeah, of course. Very interesting. And during my conversation with you, I may use analogy using war, weapons, etc., etc. Hopefully it's not offending to you. But in essence, the treatment of cancer is literally a warfare. We have the same logic from tactic to strategic approaches as human warfares. And when we talk about this new gene therapy, etc., I think it's helpful to go back a little bit to old so-called chemotherapy. And the story of chemotherapy is very interesting. It originated from or after the Second World War. Around that time, Hitler, in his retreat, threatening to use nitrogen mustard gas bombs for retaliation for the Allied troops. So American actually secretly shipped a bunch of nitrogen mustard gas bomb hiding in a ship hidden in this Italian harbor called Bali. And then Luftwaffe, the German Air Force, bombed the ship, causing the leaking of this nitrogen mustard toxic gas. Killed about 3,000 people. Many of them are civilians living far away from the harbor. So the American government sent one is top pharmacist, another one is a top doctor, over there to investigate what's going on. So these two doctors find out the toxic side effect from this nitrogen mustard gas bomb, and later on they become the first chemo reagent. So from that point on, you can see that the health is always linked to the warfare, and all these innovations are linked with warfares. But from that point on, the chemotherapy started to develop. And over the years, our weapon against the cancer can be simulated to something like fire, or the knife, or the poison. These are the common weapons we're dealing with everything else. The fire is similar towards the radiation therapy. The knife, of course, is a surgeon. We have been cutting cancers many, many hundred years ago. And then the poison is all the medical treatment. Chemotherapy is one, and other things, including the current new immunotherapy, etc., all kinds of things can be categorized as the poisons. So over the years, we always try to refine our weapons. So we develop more chemotherapy. And we also find out this cancer is not unchecked by itself. We have all heard about those interesting stories. Somebody got a cancer and then suddenly has been stung by a bee, swollen up like a balloon, and after that the cancer disappeared. And I have a patient has stage 4 liver cancer from hepatitis C. Biopsy confirmed. And doctor said to him, well, go home, 3 months to live. And he went to a naturalist having some kind of toxic herb, half dead. And after that, the cancer is regressing. I'm still seeing him 10 years later. He has this liver cancer stage 4. And his liver cancer marker of AFP is still high there. But his cancer has been controlled. So you will have to wonder what is going on. Because inside our human body, just like inside a country, the cancer cells raise their army, and we have our own army. The cancer cells cannot progress without being checked. But why the cancer cells always win in the end, or most of the time they win in the end? Because they first try to blind your own security forces, sneaking into it. Second, they can disable your immune system. That's where coming in with all this immune therapy. And immune therapy, in essence, is number 1, agitate your own immune system. So we have this anti-CTLA-4 ipilimumab, and all the modern new fancy things you listen on the televisions, the nivolumab, Keytruda, etc. They are immune agitant. So they basically tell your immune system, right now, you can go ahead, fold your eyes and start to shoot. So those guys go there and shoot. Of course, they can shoot a lot of cancer cells. Another way of immune therapy is actually borrow the technology from so-called gene therapy you mentioned. What is a gene therapy? We know that we are all comprised of gene. Your hair color, the shape of your nose is determined by the gene in your chromosome. And I want to use this analogy of a car. So every year, say Honda, they have a new version, 2018. They find out the difference of 2018 probably resides on the shape of the front door, the shape of the light. So how do you change in a manufacturer level the shape of certain features? You need to go to their design room, headquarters, tell them, well, they change this design. So then they notify the manufacturer, change the mode of their front head light. The same thing. We have all kinds of genetic features. If we are not happy with a feature, then we need to go to, I need to change the gene. How to change the gene? So initially, people find out the reason or the purpose for gene therapy was initially designed for gene deficiencies. We call SCID, severe combined immunodeficiency. Those people, their gene, particular fragment is inefficient. So I have to import a good one to these people. So people try different vectors to import a good piece of gene, go to those bad cells, incorporate it into their DNA, and then hopefully their gene and their cell can secreting and making the product from a good gene. So that's the original nature of this gene therapy. And gene therapy has various success and failures. And I remember during my training years in NCI, at that time, the first group of gene therapies for other benign disease all become leukemic patient. So all die from leukemia. So that was shed some kind of doubt. But later on, because this gene therapy has this very good approach and promise, people start to utilize this technology to crank up more new things. The current very promising therapy called CAR T-cell, chimeric antigen receptor, they are actually utilizing this level of weapon or tool to get a piece of gene using the gene therapy vector and engineer your immune system So enable your immune system become more potent and specific. I gave you an analogy. The soldiers cannot fight somebody. Okay? I will enable the soldiers have 3 arms, 3 ears, 10 eyes. They can holding 10 times the weight of weapons. So basically, we're using the gene therapy technology to enable the T cells having more capacity to recognize the cancer cells in order to kill them. And so that's part of the small stories about the gene therapy.
Well, that's good. We here at Nova Southeastern University have a rather new, we're about 2 years old. We created a very significant research venue. It's a 238,000 square foot building, and part of that foci, you can't be everything to everyone when it comes to research, but one of the areas happens to be cancer therapy. Now we're back to you, Kelly. Again, you got one of Dr. Drew's patients?
A lot of times when I see a patient, what we do is kind of patient-centered diet planning, because really one size doesn't fit all when it comes to nutrition. There's a lot to consider: what treatment they're going through, what type of cancer they have, and I think a common misconception is that even with one specific type of cancer, for example breast cancer, there are so many different things with each woman's individual breast cancer that actually could, affect their nutrition plan. So like before, you were mentioning how everyone Googles and looks things up. It's important to know that what might be appropriate for one person's cancer in relation to their diet is not appropriate for all. So that's where we come in as dietitians to really help tailor a diet that works best for that person, especially when they're going through something like chemotherapy. There are a lot of side effects, and while the backbone of a healthy diet for cancer treatment or prevention is the same, we know that we have to make some modifications for that patient when they're having those side effects.
Dr. Drew, you wanted to say something?
Wonderful, yes. Actually, we have more than one real patient. Besides designing the actual dietary regimen for my cancer patient, Kelly has the role to demystify a lot of misconceptions during the cancer treatment from a nutritional standpoint. Very often, the patient will come to me during their chemo, already underweight, already be compromised by the cancer. Well, I eat very healthy. Why I'm getting weaker and weaker? So then Kelly, with a better understanding about what is nutrition, what is us, the so-called healthy, if we know that every lab test has a normal reference. Too high is not good, too low is not good. Healthy is within a normal reference. In this country, we have a misconception about so-called healthiness of food, because too many people are too fat. So for them, the healthiness is nutritionally depleted food, so that they can bring them from there to here, normal. Many of the cancer patients are already there. The healthy for them is actually fattening food. We have to bring them up to get into the healthy zone.
You, as a registered dietitian, you must know that I'm sure that you mentor your patients and tell them to become label readers, correct?
Absolutely.
When they go into that supermarket, I mean, there's a lot of things that face them, but they very rarely read that label, correct?
Yeah, and actually, since starting at Holy Cross, I developed a program where I take some of the cancer survivors on like a supermarket navigation class. So we'll go to the local Publix and we'll walk around, and we have some sayings like shop the walls, not the halls, because the walls have all your fresh produce, your fruits, your vegetables, your whole grains, all the stuff that you need for the basic backbone of your diet. And then the processed stuff is going to be on the innards of the supermarket. So when we go, we practice label reading and compare things, because as you know, I'm sure, the labels and marketing are kind of tricky, because sometimes they can take a claim that might be true. For example, whole wheat bread, or whole wheat bread is what we want to be looking for. multi-grain bread might be whole wheat, but it might also just have an extra sprinkling of oatmeal on the top, and then there's your 2 grains, it's multi-grain. People think that's healthy, but until you really dive into the label and know what to look for, you might be getting duped by the label.
Well, one of the things that, and again, not to get too far away from Dr. Drew and his very highly skilled area, but you know, with reference to labels, a lot of people don't look beyond the actual ingredients, or and in pharmaceuticals they list active ingredients, except that over-the-counter preparations. But then when it says other ingredients, it's a lot of the things in the other ingredients that are the problematic issue, correct?
Oh, absolutely.
Yeah.
Yep, and again, if you don't know the specific words to look for, they
Right.
can hide sugar under different
Oh, yeah.
names. And sugar actually is one of the myths that I think Dr. Drew is referencing when it comes to cancer and nutrition. Probably every day somebody comes in and says, oh, well, I've cut all sugar out of my diet because sugar feeds cancer. And while every single cell in our body uses glucose, which is another name for sugar, as energy, so do cancer cells. But it's not as simple as just cutting out sugar altogether. Otherwise, these patients, they are tired, they're fatigued, they start to lose weight, and we know that then they can't get through the treatments as well as if they're well nourished. Also, the stress and anxiety of following such a rigid diet sometimes can be even more detrimental for someone battling cancer.
Dr. Drew?
Kelly, you can use my analogy.
I was,
Go ahead with
thank
it.
you.
Yes, sure.
He has a great analogy that he uses in this myth, and it goes back to the whole warfare scenario. So when people say, oh, but if I just cut out sugar, then my cancer cells can't grow, he will tell them that, well, think of your body as a village, and the bad guys are invading your village. If you cut off the food supply to that village, who's going to die first? The good guys, the village people, not the bad guys, because the bad guys are going to eat up those nutrients. So there was a study done, I believe with NYU and some other universities in collaboration, and it showed that in pancreatic cancer, some of those cancer cells can actually break down your healthy tissue to come up with the fuel when you're not able to eat enough to fuel your body and, unfortunately, the cancer cells. So while at the end of the day, every cell uses that glucose, we can't just totally cut out sugar. So what I tell people instead is to go for foods that have more health benefits. So sure, if you cut out table sugar, that's going to be great because there's no vitamins, minerals, fiber. There's nothing in there that's going to help you. If you're choosing fruits and vegetables and whole grains, sure, some of those foods will turn to glucose, but they're going to give you vitamins, minerals, fiber, antioxidants, and then phytochemicals, which are plant cancer fighters. And it's not only cancer, but other diseases as well. So they might fight against inflammation. They might give you those antioxidant vitamins. Also, it's important to note that eating lots of that extra processed sugar does lead to obesity if your calorie balance is off. If you're taking in more calories than you're expending, then yeah, you're gonna gain weight, which could lead you to be obese or overweight. And we know now that obesity causes this chronic low-grade inflammation, and inflammation can promote cancer. So there's a lot to be said about sugar-feeding cancer, but the bottom line is if you're choosing whole, healthy fruits, vegetables, plant foods, and sweets and treats seldomly, once in a while, that's the most important part.
Well, we've been talking a lot, and we're down to the last 3 minutes of this show. So I'm going to turn it over to Dr. Drew, and I'm going to ask Dr. Drew to tell our viewers, if you have any indications. I always tell our viewers they have to take good care of themselves, and that means they have to see their primary care physicians, I always say, more than once a year. Obviously, upon occasion where there's a disruption of your normal, natural life, you're going to get to see these people more often. But I want them to be in a situation where if they need the good services of a person as capable as Dr. Drew, then the only way for that to happen is for the people to visit their doctors and then be immediately moved up the line to get to Dr. Drew. So Dr. Drew, you got a minute and a half to talk about whatever you want.
Yes.
Beyond warfare.
Very good. About navigation. Right now, the healthcare system becomes so complicated. We have to hire new people called navigators. And more than one occasion, patient has been diagnosed from outside, delayed because doctors don't know how to arrange all these visits. Biopsy, this scan, that scan. When patient come to us, our navigator streamline everything. From the time you get here, biopsy, brain scan, CT scan, PET scan, all kinds of things, and tumor, we can accomplish usually within 7 to 10 days. And so that's the thing, partially answer your question. Number one, for the primary care, routine cancer screening is a very important part. Number two, you need to find a savvy place that has a streamlined mechanism to optimize your cancer care in this sophisticated medical environment.
You hit it right on the nose. You got it. Well, we're down to the last 40 seconds of this show. I want to thank you, Dr. David Drew, very much, not only for your knowledge, but for your advocacy. I can hear it in your voice and your plea for people to understand your metaphorical relationship to the war and the warriors and whatever is very important. And I hope people listen very carefully to what you said. And I want to make sure that everyone knows that you're the hematologist, oncologist, and you are at Holy Cross Hospital's Vienna's Comprehensive Cancer Center, and that the physicians can refer to you directly. And I hope that you continue to have more patients that are 102 years old.
It will be my pleasure. One small thing to mention, we are salaried in the Holy Cross Hospital, so we're not pressured to give patient chemos.
I'm aware of it.
Okay.
And Kelly, thank you for your information and your knowledge. We appreciate your involvement as a registered dietitian, also at the Holy Cross Hospital of Comprehensive Cancer Center. And thank you both for being here today. Folks, I hope that you got some information. I know some of it was, I guess you could say almost technical, but not quite. But I want you to listen very carefully to what Dr. Drew said and what Ms. Kugler said. And remember, it's only for your benefit. I always tell you to take good care of yourself. The way you take good care of yourself, see your doctors, get the various, required knowledgeable tests. And if you need a navigator, then find out a place where you can get a navigator. And remember, this is your show. If you have any questions or comments, there's an email address and a telephone number right here. And remember, as I always tell you, this show, as I just said, is your show. It's called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see you.